Masks are mandatory if you're out in public in Alabama starting on Thursday. The governor issued the order today after the state reported 40 new deaths. That's a single-day record. NBC News Now correspondent Dasha Burns joining us now from Montgomery. And Dasha, what did the governor say about her decision today?
Hey, Allison. Well, the governor had been resistant to this kind of order until today. And at that press conference, she said that the numbers don't lie. And the numbers here in Alabama have been staggering. They've been hitting records almost every day for the last couple of weeks when it comes to cases, hospitalizations and deaths. Yesterday, a record number of hospitalizations, more than 1,300 patients hospitalized. At that press conference, they said 2,100, more than 2,100 cases actually overnight. And that's really what led her to make this decision. And Allison, when you look at a chart of hospitalizations here, those numbers, that curve just goes straight up, especially over the last couple of weeks. There's been a more than 50% surge in hospitalizations over the last 2 weeks. And the doctors I've been talking to here have been emphasizing how important masks are. They've told me that they've been hoping for and asking for this kind of order for a while now. And considering the trends in Alabama right now, it could not have come soon enough, Allison.
Doctor, the lieutenant governor is disagreeing with this mask order. Why is that?
Yeah, and this is not the first time that's happened. He came out today, and let me just read a quote from him directly. He said that the mandate is an overstep that infringes on the property rights of business owners and the ability of individuals to make their own health decisions. And back in April, he also urged the governor to open up businesses more quickly than she was willing to. So those two have split in these kinds of matters in the past. But certainly on this mask issue, he sees it as a personal rights issue, it seems, Allison.
Dasha, we can see the emergency room signs behind you. You're clearly at a hospital there in Alabama. What is going on there?
Hospital in the pouring rain, Allison. It's been some Alabama weather here today. Well, I mentioned the hospitalization records earlier. That is coupled with record low ICU capacity. Right now, across the state of Alabama, ICUs are 85% full. There are only about 253 ICU beds available in the entire state. And when it comes to this hospital, I'm going to let Dr. Lisa Williams tell you what's going on. Take a listen to what she told me this morning. How many ICU beds are there in this hospital today?
0. I mean, coronavirus has not gone away. And, you know, we all want it to go away. I was, to be honest with you, hoping when we met, we wouldn't even be talking about coronavirus.
And Allison, Dr. Williams also tells me that she's starting to see younger and younger patients not just test positive for COVID-19, but get hospitalized and need intubation. She says she's got people in their 20s and 30s in her ICU right now. She has pregnant women in her ICU, and she's just emphasizing, especially to younger people who might feel invincible, that they are not, and they could wind up in one of these ICU beds if they're not more careful, Allison.
Dasha, what else are doctors, healthcare workers there telling you about the emotional stress of just trying to keep up with the coronavirus surge?
Allison, it's been heartbreaking. I've had a couple of really, really tough conversations today. I've had doctors break down in tears because they and their staff, they're just stretched so thin. They're exhausted. They're emotional because especially the nurses, they're taking care of these patients for 12 hours a day. They're with them when their family cannot be with them. These patients are alone in some of their darkest hours, and it is these healthcare workers that are there with them, and it takes a really big toll. And right now, the biggest problem is they say they're not really seeing the light at the end of the tunnel. The trends are just so grim, and they're seeing these records every single day. I want you to hear from Dr. David Thrasher. He's the head of pulmonology here at Jackson Hospital. Take a listen to how he described it. So you're getting short-staffed because staff are getting sick or having to quarantine.
Yes, that's a big part of it, but also the emotional trauma on these heroes here. It's tough. I get pretty emotional about this. Yesterday, excuse me, on rounds, one of our great nurses, been here 27 years, broke down. She said, I can't take it anymore.
Allison, that's still so hard to listen to. They are seeing what this is doing to people firsthand. And while I'm out here talking to you about the numbers, they are inside the hospital right now taking care of the patients, and the work that they are doing, the challenge that they're seeing right now just cannot be overstated. Allison?
Yeah, Dasha, we talk about it so much, like you said, but I just can't imagine what it's like to go to work every single day and knowing that you may lose lives that day, knowing that the battle has not gotten better. Dasha, thank you so much for your reporting, particularly out there in the pouring rain today.
Thanks, Allison.
Walmart is telling customers no mask, no service. Starting on Monday, more than 5,000 of its stores in all 50 states will require people to wear face coverings. NBC News business and technology correspondent Joe Lynn Kent joins me now. And Joe, this is the nation's largest retailer. What made them decide to make this change right now?
They said it is about public health. It was really simple, and they're following in the footsteps of Starbucks and Best Buy and other big retailers. You have to remember there's 5,000 Walmarts across the country, so they're kind of wading into what has become a divisive political debate. But what they said is that in addition to posting clear signage, which is what you're going to see on Walmarts, they're actually going to be having new people play the role of health ambassador, as they call it, and will station them near the entrance of Walmarts to remind people who are not wearing a mask of this new requirement, and they're getting special training to do that. So as you can imagine, so many of us have seen folks get pulled over in the grocery store, if you will, for not wearing a mask. And now Walmart really taking a bigger step on this front. But we should note that Walmart is acknowledging that this is a very controversial thing for them to be doing in some of their stores. They said in their blog post today, we know some people have differing opinions on this topic. We also recognize the role that we can play to help protect the health and well-being of the communities we serve by following the evolving guidance of health officials like the CDC. So this is a very big moment in retail because it does supersede some of the regulations that are put in place in certain parts of the country.
Joe, you mentioned some of the other big companies, Costco, Starbucks, already requiring masks. Best Buy will also require face coverings starting next week. Do we know if the requirement has affected their business at all?
You know, it's hard to tell because we're in the middle of a quarter right now, and it's difficult to kind of measure that from the company's perspective. But we do know that Kroger today, a major grocery store, now mandating it across the board. And the real difference that you're going to see as a shopper is that, you know, previously when you went into a grocery store or a Target, say here in Los Angeles, where masks are already mandated in any sort of public space, that was the sign in the front citing the specific local ordinance or rule, if you will. Now that is going to be the blanket policy at these companies, and the idea is they need to play a role in preventing the spread, as so many businesses, large and small, are grappling with the reality of how dangerous this ongoing wave has been.
Yeah, it's a tough decision to make because I know there are a lot of differing opinions on it. Tough one for businesses, but glad to see that more companies are signing on and trying to keep folks safe. Joe, thank you. Are you immune to the coronavirus once you've had it? There is new evidence that protective antibodies can fade after just a few months. NBC News spoke to two women who tested positive more than once since March. NBC News medical contributor Dr. Lippy Roy joins me now. And Dr. Roy, what are you learning about people getting reinfected with the coronavirus? What do we know now?
Yeah, well, what we're learning, Allison, is that having the infection does not necessarily confer immunity, nor does it really prevent reinfection. Now, that said, we still need to get a lot more data to understand what the infection, reinfection status is. But there was a British study showing that the antibodies peak about 3 weeks after infection, but then they wane or go down about 60 to 90 days. This is a problem, however, Allison, when it comes to when you think of herd immunity, right? You need to have lasting antibody or immunities in order to develop widespread immunity to an infection.
You're in New York City. This is a city that has been on the rebound after being hit so hard early on. Are there concerns that people could get reinfected as the city reopens?
That's a great question. It's a very legitimate concern because right now we are seeing people who may in fact be getting reinfected. Again, we're not sure. Some of these cases where we're seeing potential reinfection, it could have been because maybe one of the earlier tests were a false negative and they were always still positive. We don't really know, but it's not accurate to say that reinfection is not possible. And if that's the case, if reinfection in fact is possible, which we think it is, then we really have to put a hold on any type of reopening of businesses and most certainly schools, because we still have to learn a lot more about children and their infectivity and transmissibility of the virus. Allison.
Biotech company Moderna is about to test a vaccine on 30,000 people. Former FDA Commissioner Scott Gottlieb spoke about the vaccine timeline earlier on MSNBC.
I think all the incremental information that we've seen from the different vaccines in development leads us to believe that it is possible to develop a vaccine against this virus, and one or more of these manufacturers is likely to be successful. I still think that a vaccine available for mass inoculation of the population is likely an early 2021 event. I think if we have it available in 2020, it's likely to be for a selected population, maybe under an emergency use authorization. But I do think that we're going to get a vaccine to COVID.
Dr. Roy, even if a vaccine is ready early next year, how do you convince people that a newly developed vaccine, one that was developed pretty quickly, is safe?
Yeah, that's like the million-dollar question, Allison. So let's take a step back.
Yeah.
Things in general are actually very safe. A and B vaccine, I encourage all of my patients, family, friends to get vaccinated for other illnesses for which we have a lot of data on the disease and the vaccine. For coronavirus and specifically COVID-19, Allison, as you know, we are literally learning something every day. And as Dr. Scott Gottlieb was saying, it is unprecedented for us to develop a vaccine this quickly. Again, obviously, before they mass produce and deliver it directly into patients, they're going to have to really test for safety before they make it available to the public on a large scale. So, I mean, I think my initial instinct is to say that it's safe. As for how effective it will be in terms of long-term immunity, only time will tell for that, Allison.
Dr. Roy, we have a viewer question for you about blood type. There was some evidence earlier in the pandemic that blood type might be a coronavirus risk factor. What have recent studies on blood type shown?
So it's actually been really interesting. It's an interesting correlation. So a study from Wuhan, China showed a correlation, or rather increased risk of COVID infection amongst people who have type A blood, whereas people with type O blood have a lower risk of getting infection. And the people with type A blood not only have an increased risk of COVID infection, but also increased risk of death associated with that. Now, we need a lot more information. We're not really entirely sure why there's this correlation. And again, it's correlation, not causation. But we think that the genes that are related to blood type are also the same genes that are related to immune function and conferring immunity. It's important, though, for the viewers to understand, though, Allison, that just because you have type A blood doesn't mean you're necessarily going to get infected. Conversely, just because you have type O blood doesn't mean that you're totally in the clear and you'll never get infected, because we've seen both happen. People with type A not getting infected, people with type O getting infected. So you still got to practice wearing the mask. I've got my N95 here, and you got to practice the social distancing, yep. Allison.
Dr. Roy, we also have so many questions about this virus. Thank you for helping us to get just a little bit smarter, to understand it just a little bit better. Thank you.
Anytime, Allison. Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.